How does HIV affect TB diagnosis and treatment? Imagine trying to find a hidden problem in a complex puzzle. When someone has both HIV and tuberculosis, this puzzle becomes even trickier to solve. HIV weakens the immune system, especially by lowering the number of CD4+ T cells, which are crucial for fighting off infections like tuberculosis. Because of this, people with HIV are much more likely to develop active tuberculosis if they have a latent infection. In fact, the risk can be up to 26 times higher than in people without HIV. Diagnosing tuberculosis in someone with HIV can be more challenging. Usually, TB shows up with symptoms like cough, fever, and chest X-ray findings. But in people with HIV, these symptoms can be less obvious or different. Sometimes they don't have the typical lung involvement, and the infection can spread to other parts of the body, making it harder to detect with standard tests like sputum analysis or chest X-rays. To improve detection, newer tests such as molecular assays and urine-based tests are now used more often, especially in HIV-positive patients. Treating tuberculosis in someone with HIV also requires extra care. The interaction between anti-TB drugs and antiretroviral therapy can cause complications. For example, some medications may interfere with each other or increase side effects. Timing is very important. Starting antiretroviral therapy too early or too late can lead to problems like immune reconstitution inflammatory syndrome, where the immune system overreacts as it recovers. Despite these hurdles, integrated treatment programs that address both HIV and TB together have greatly improved outcomes. Preventing tuberculosis in people with HIV is also vital. Since their immune systems are weaker, they are at higher risk of developing active TB from latent infections. Preventive treatments like isoniazid can help reduce this risk. Antiretroviral therapy itself helps by restoring some immune function, which lowers the chance of TB developing, but it doesn't eliminate the risk entirely. In summary, HIV makes diagnosing tuberculosis more complicated because of atypical symptoms and less obvious disease signs. It also complicates treatment due to drug interactions and immune system challenges. Effective management involves using advanced diagnostic tools, carefully timing treatments, and providing preventive care. Always remember, if you or someone you know is dealing with these conditions, consulting healthcare professionals is essential to get personalized and safe treatment options.